This podcast is being brought to you in part by the veteran-founded Hero Soap Company located in Phoenix, Arizona. In today's environment, we must be aware of the products we apply to our skin. As a two-time cancer survivor, I cannot afford to take chances, and I use these products myself. The soaps will leave you feeling clean and refreshed. All the products made by the Hero Soap Company are made in the United States with the highest quality ingredients sourced from companies in the United States whenever possible. The products are made in small batches to ensure high quality and contain premium essential oils and fragrance. All Hero soaps are created without synthetic colorants, parabens, and sulfates that are irritating to the eyes, skin, mouth, and lungs, and are cruelty-free, meaning these products are not tested on animals. Each 5-ounce bar of soap is handmade in Phoenix, Arizona, and the body wash is available in 8 ounces with such refreshing scents as the woods, tea tree, lavender, the fields, bourbon, lime, the pines, and Arctic. You will absolutely love this soap. Please also check out their gear for sale. All the products are reasonably priced. Being veteran-founded, the company understands the dedication and sacrifice that each family makes to serve their country. A portion of sales is donated back to charities that are focused on helping veterans and our first responders. Over 1,200 bars have been sent to our deployed troops. Please check out their website, herosoapcompany.com, for pricing and a detailed description of all the products. When ordering, use the code RAP for a 10% discount. The company information will be listed in the podcast notes and featured on the podcast website, Facebook group, page, and the podcast Instagram. Welcome, everyone. It's a Wrap with Rap. I am your host, Ron Rappaport. Before we start, I would like to thank all of our listeners, sponsors, and supporters that have helped to make this podcast so successful. The podcast is being heard in all 50 states, all provinces of Canada, and over 45 countries around the world. The podcast has been ranked by FeedSpot as one of the top 35 overcoming adversity podcasts on the web in that category, and ranking is determined by traffic, social media followers, and content freshness. Please visit our website, itsawrapwithrap.com, for all the episodes, podcast logo merchandise, of which a portion of all merchandise sales is donated to cancer, lymphedema, and rare diseases research and other information regarding the podcast. This podcast features people who have overcome life's challenges and adversities, people who can inspire, motivate, and educate us on an assortment of topics. My guest today is Wes Michael. Wes has been a market research industry veteran for over 40 years and has over 20 years experience in the healthcare marketing research field. Wes earned his MBA from the University of Chicago, Booth School of Business, and a BA in English from the University of Pennsylvania. In 2013, Wes launched Rare Patient Voice based on a novel approach to building a market research panel, one that enables patients and caregivers to share their voices with the researchers and companies developing products to improve patients' lives. He structured the company on the core values of being a good resource for patients, a good partner to clients, a good employer to staff, and a good citizen in our community. Wes has seen the company grow, expanding from the United States to Canada, the UK, Spain, Italy, France, and Germany, completing thousands of projects and providing customized service to hundreds of clients. Rare Patient Voice provides patients and caregivers an opportunity to participate in all types of research, including market research, health economics outcomes, real-world evidence, user experience, human factor studies, and clinical trials. Rare Patient Voice has over 100,000 patients and caregivers across more than 700 diseases, both rare and non-rare. It is the hope of Wes that Rare Patient Voices work can help the lives of patients and caregivers who are able to participate in these studies and of those that come after. Welcome, Wes, to the podcast. Thanks so much for being here to tell us about Rare Patient Voice and answer our questions. We want to educate our interested listeners on the participation process.
Well, thanks, Ron. I was looking forward to this. So this will be great.
Awesome. We're so glad to have you. Let's start at the beginning. How and when did you come up with the idea for starting Rare Patient Voice?
Oh, wow. So that goes back like 25 years ago. I had just gotten into healthcare market research. I was a market researcher doing Wheaties and Cheerios and spices and things like that. Those are great things, but it's not like life and death, right? It's not like
right.
I got into the healthcare side, and a couple things. One, I noticed the obvious: patients are passionate. It's their life and death. It's their, more important, it's their kid, right? It's their kid's life and death. But they really want to share their stories, even if it might not help them. It might help those coming after. So I saw that these people were so passionate about it, but it was tough to find patients, especially those with rare diseases. And then a client came to us. I was working for this market research company in the hemophilia space, and there's only a few thousand hemophilia patients in the whole country. And they said, "Hey, can you build us a panel of patients and caregivers? And then we want to learn. We really want to learn what they have to think. We want to do surveys. We want to do interviews. We want to, get the voice of that patient." So we did it. We worked. We went to the hemophilia conference. We set up a table. We gave out. I remember giving out little balsa wood airplanes, little gifts and stuff to attract people. And it wasn't even online. It was paper and pencil. And people signed up, and it worked. They did a lot of surveys and interviews, and they really learned what people thought. And every year we'd go back to the big national hemophilia conference, invite more people to join. But one year I went back to that conference, and somebody from a different pharma company, different company in the hemophilia, came up to me and said, "I hear you have this panel. Can we access it?" And I was like, "No, different company paid for it, right?" But It got me thinking, wait a minute, why not create a group of folks that aren't beholden to any one company? They can take part in all sorts of surveys and interviews. Well, I had that idea for many years, right? I didn't do anything about it. I had to be forced. I lost a job at one company. Well, I didn't quite lose it. The guy was running short of money, and he said, "Hey, how about if I don't pay you for the next 3 months? And we'll see how things go." And I'm thinking, I'm not going to get paid. Maybe there's something else I'd rather do.
Yeah, right.
So I started it. So I had to be pushed, and I started. And guess what? I started with hemophilia because I'd done it before, right? I knew it. Right. And now, as you said, we're up to hundreds of diseases and stuff. But who knew? It just I had that little idea, and I said, I think there's something there. And,
wow, that's great. What were your initial hopes and goals for the company?
Well, at the beginning, I didn't know. I didn't know whether it would just be hemophilia and it would just be me, and maybe I could make a living at it. I didn't know, but I was hoping to, hey, let's give rare disease patients a chance. And I would go to walks with MS walks around the country I went to and sign people up, and I would take my kids on weekends because you get involved in these walks and things, right? They're generally a Saturday or a Sunday morning, and people come and gather, and then they walk and they raise some money. And so I took my daughter to Albuquerque, and she always said, "Oh, I want to move to Albuquerque." And my son loves Chicago, and he visits the firehouses there and stuff. So I didn't know how that would work, but so I was just, let's see what happens. And now we're 10 years later, and thank God I'm not the one doing all that work anymore. All these wonderful people are doing it, and we've done 8,000 some projects. So
wow, that's a lot. So Wes, what was the biggest obstacle you encountered in those first few years, and how did you overcome it?
Wow. One of them, and probably a lot of people with small businesses have this, it's a balancing act between, you don't want to hire a million people, and if you don't think you're going to be able to keep them, right? You don't know how the business is going to go, but you have to get the work done. I had a rule I made for myself. If I'm working to midnight every night, it's time to hire somebody. So after a year, I'm like, okay. And I hired this guy, and he was great. And then another 6 months, it was midnight again. I hired, and I remember, it's funny, they're all still working with us. And the second guy I hired, I said, "Dave, we have a lot more business now, but I don't know if it's going to continue. I mean, and if it doesn't, I'll have to let you go." He says, I get it. So he jokes with me now. We keep hiring new people, and I say, he's like, we've never had we've never had that problem, knock on wood. But that's it's always when you're new, it's and the proverbial cash flow, because you sell all this work, but then you got to wait for people to pay you. And we made a point when we can get into this, but when we do a survey, we want to pay the patients right away. We get a check out to them before we get paid. So as you can see the cash flow issues there. We're paying out before our clients are paying us. So it takes a little I hope this works out. But again, 10 years later, it did. So faith was well placed, I guess.
Yeah, and that's a big risk when you start paying out before you get paid.
Hey, I took my, at the time I didn't think it was a big risk. I guess, it's rose-colored glasses or something. But I didn't have to take any money from anybody, but I took money from all my savings and 401k and stuff and put it in. And again, it turned out to be a good investment, but it could have been like, I'm sorry, honey.
Yeah, especially if somebody, doesn't pay.
Yeah.
So how is this private medical information people are being asked to relinquish to be in the studies? How is all this information being kept confidential?
That's key. That's key. As I always tell people, if it's not, we're out of business, because nobody's gonna. This is important stuff to people, and it needs to be private. So there's a lot of things that we do. When people sign up with us, we ask a minimal amount of info. Because a lot of people think, you have all this information. No, we want to have enough just so that when we get a survey request, we know who to send it to. So we want to know people's disease and, the usual age and gender and things like that. But just enough so that we can say, hey, here's a study you may be interested in. And so one thing is we don't keep a lot of that stuff. Now, everything we do have, or when we work with clients who ask more detailed questions, there's all sorts of things. We use this special kind of portal. We never put anything in an email that has that information. There's these portals, HIPAA compliant. HIPAA, your listeners probably realize, is the act that makes sure everybody's data is kept confidential. It's the reason when you go into the doctor, you can't just tell anybody that asks your information, right? You got to sign all these forms and give them permission. So we use a special portal to move that data around, so it's never just sitting out in an email. We just went through this huge process. It's an audited process, and it's got a complicated name. It's called ISO 27001. It's a security process, and you really have to prove that you're doing everything right. So we went through this process, and we got accredited. So we're very proud of that. So there's so many things we have to do. You have to have all the computers set up a certain way. You have to have this multi-factor authentication. There's so many little things that we were doing a lot of it. This forced us to make sure we had everything buttoned up, such that nobody can just get on. We can't use any flash drives, because bad things can happen. So there's all sorts of things that we do to keep everything confidential. And we don't do anything without people's permission. We don't share any of their information until they say this is fine. And then over time, people get it. It works well because they say, knock on wood, that we've never had any issues or breaches, and people trust us with that. But that's our most important asset, right? The trust of people, because you don't want your health that you can't have it out there. It's nobody else's business. So
I've read where Rare Patient Voice really doesn't know the answers.
Yeah.
Of the client, and the client that wants the study done doesn't know the patient's identity.
Yeah, it kind of reminds me, right? Like to set off the atomic bomb, right? You have to have several people. So same thing. So when we do a survey, for example, there's a special link. Everybody gets an individual link, and their data goes to a client. The client has no idea who the person is. We give everybody a secret, long ID code.
Right.
And then we know who did it because we pay them. So we know John Smith did it at this address, and we send him a check, but we don't see any of his answers. And the client knows that 1111115 or whatever did a study. They don't know who it is or anything like that. So really, it's a really good fail safe, if you will, to make sure people are protected.
Okay. So everybody out there, when you sign up for these studies, this is all confidential.
Oh, yeah.
You don't have to worry.
That's our number one thing.
Right. Rare Patient Voice is gone. the extra link to be accredited. So it's all HIPAA approved, and you don't have to worry about any of your information getting leaked out. Now, Wes, what changes have you seen in the healthcare market research field over the past 10 years?
I think people have, it used to be people would do a lot of in-person interviews, focus groups and interviews. So they'd invite you in to a facility down in the middle of a city or sometimes in the suburbs and do research that way. Well, couple things, COVID happened, right? All of a sudden it's like, don't be coming in, especially people, right? Compromised immune systems. They don't need to be sitting with other folks or even coming downtown. So people continued a trend to, wait a minute, like we're doing, what can you do on Zoom? You don't have to be there in person. They used to do phone interviews, but now it's like, hey, might as well do Zoom, see the person as well as hear what they have to say and show them materials. That you want to read a description of a product, you can show it to them rather than read it. So the big thing there is so much has gone remote, and that's been a great boon for, so people outside of New York and Chicago can share their voice, right? Somebody in the middle of Montana can be involved in research where they never were invited in the past. So that's one thing. Another thing, researchers, it's a very competitive field, all these market research companies, because they're selling to all the pharma and biotech and device companies, and they want to show some new methods, interesting ways of doing things. So they'll send a camera crew to people's homes rather than just talk to them. They'll say, let's go into their home with their permission and see how their life is from day to day, right? Let's see how they use our product. Let's see what they do, because that's how companies get ideas. How can we give them programs that might help them? Because they actually see them. So companies are doing more interesting things like that. They may even do things like, rather than ask questions, they may say, hey, here's a little homework assignment. Make a collage or think of things like that so they can get underneath the surface, right? See how people are thinking. So there's a lot of things companies are doing now that they weren't doing nearly as much in the past. Fortunately, there's still boring online surveys. I like to say, I get invited to do things for banking. I'm like, oh, this is just boring. All these things, so anyway.
Yeah. Yeah, well, these new things that they're doing sounds exciting.
Yeah.
Now, Rare Patient Voice is seeking patients with rare diseases, but you're also asking for non-rare disease patients. Can you explain to us?
Yeah. When I started, I just assumed that I knew there was a difficulty in finding the rare patients, as I said, right? But I assumed there was no difficulty in finding the non-rare, the people with diabetes or anxiety or asthma or whatever it might be. Right. And but then a couple of things happened. One thing is, guess what? Most people don't have one condition, right? You might have back to hemophilia, but you may with that have anxiety or depression or diabetes or whatever it might be. And so people would say, wait a minute, should I put those other conditions down? Or they might say, hey, I want to sign up. My friend here has high blood pressure. Can she sign up? And we're like, I hate to say no to people, but I don't know if we're ever going to need them. Well, just as people were asking those questions, some client came to us and said, hey, do you have diabetes? Do you have asthma? And we're like, okay, we're not saying no to anybody. We're going to let everybody sign up. And I thought, well, we still may not get studies in those areas because these big market research panels that research Cheerios and Chevys or whatever, they're going to have enough people with the common diseases. But I was wrong again. People come to us all the time for the non-rare. So we're happy to give everybody a voice. We didn't want to change the name though. We have Rare Patient Voice because the focus is on rare. We think about it. So we added a little tagline. Actually, you probably can't see it. He's on that little zebra behind me. It says also non-rare.
Yeah, I saw that.
In fact, that's everyone. But yeah, I had never anticipated that. But hey, why should we say no if people want to do it and the clients are asking? Who are we to say no?
So, Wes, can you explain to our audience the process of applying for a study?
Sure. So there's basically two parts. First, there's applying to get on the panel. When we try to make it as easy as possible, we go to a lot of events in person, right, where people can sign up and sign a form and do it. We love to see people in person because that's a two-way street. They see that we're real people, right? We're not just some guy stalking you on the internet, and then we see they're real people because I didn't believe this, but there's a ton of fraud in market research. There could be a bot in Thailand pretending to be people doing surveys to get $3 or something.
Let's break away for a moment to address those men and women over 45 struggling with knee pain to alert you how you can learn to cut your knee pain in half without harmful drugs or invasive surgeries. Todd Kaliskas is an injury prevention expert who specializes using Eastern and Western holistic practices to speed up the body's natural healing processes. Over the past 10 years, he has impacted the health of over 100,000 people through his online health publications. His clients include everyday people, professional athletes, U.S. military, and even nursing home residents. If you are over the age of 45, your doctor might have already told you to manage your knee pain and arthritis by gobbling up drugs like ibuprofen and acetaminophen. You may have even gotten injections or a faux knee replacement. New research is revealing there are 3 main causes of joint pain: cellular inflammation, postural misalignment, and cartilage deterioration. The CDC reported that joint pain and arthritis is now one of the top chronic conditions leading to death and disability. According to research from the U.S. National Library of Medicine, National Institutes of Health, there is a simple exercise that can decrease your knee pain by 58%. The participants in the study did one simple isometric exercise a few times a week and saw a huge reduction in pain. Isometric exercises are a simple, effective, and an easy exercise whereby you increase the tension in the muscles without moving your joints. It gives your body the ability to use its muscles without ever moving and allows your knee to release your pain for good. This easy-to-perform and painless exercise successfully outperformed the drugs and pills in both pain relief and knee joint function. Now, Todd has collected the most effective variations of isometrics that anyone can do, no matter if you have had knee surgery, struggling with grinding knee joints daily, or simply have that nagging achiness you want to eliminate. His greatest techniques have been combined into a simple and easy-to-follow 5-minute ritual called the Feel Good Knees Method. It is an easy-to-follow method that only takes 5 minutes a day to do. The program is so quick and easy, you will be shocked by how fast you will be free of knee joint pain. Here is what's included in the method: a companion program giving you a visual guide how to perform the exercises, a pain reduction tracker to measure your pain reduction progress, and a video library to learn the perfect form to perform the exercises. If you order now, you will get 2 free gifts: a postural alignment guide and a 1-minute rejuvenation finisher guide. The price of the method is affordable, as Todd's goal is to reach 1 million people. The cost to you is $15 for the digital version and $15 for the printed version, plus $7.95 shipping and handling. There is also a 60-day money-back guarantee. Please refer to the link in the podcast notes to order and for detailed information on the course.
So anyway, it's great. We see people, nobody's coming to an event, right, just for fun. They're there because they have the disease and they're, it's a
Right.
So, it's the process, right? So Well, that's one way people sign up. Now, they can also sign up online. We, the rarepatientvoice.com, and it asks you questions. Again, we don't like to ask too many, but if you have several diseases, you kind of go through it several times. You'll say what the disease is and when you were diagnosed and how severe it might be. A few key questions like that. And then our folks, because of that whole fraud issue, they go through like person by person, making sure everything makes sense. And if they're questionable, they'll call people up. And believe me, when you talk to folks all the time. When you talk to somebody, you know in a minute, right, if they're for real.
Oh yeah.
Oh, I go to Dr. Smith and I have it. Okay, lady, I know you're real. So, so that's the process to get on the panel. Now, once you're on the panel, we have your conditions, the diseases and conditions you may have, and then we get requests all the time from market research companies who in turn are working for biotech and pharmaceutical and academic and device companies, everything and anything. We get requests all the time and we match it up. So if somebody comes to us for a lupus study, we'll say, who in the panel has signed up for a lupus study? How many do we need? And we'll send an email out to folks. We like to use email. More and more, we're able to use text for things. I know I like check my texts more than my emails, but we don't call because that's kind of intrusive. Who answers the phone now anyway, right?
Right.
So we'll send an email, and we like to make it as simple and clear as possible. Put right in the headline, for example, 30-minute lupus study online, $50 reward. So people right off the bat, they say, how much time? Is it something I might be interested in? And how much do we pay? Because we pay people at the rate of $120 per hour. And
$2 a minute.
Yeah, exactly. And we paid over $10 million since we got started. So it's kind of a little Robin Hood action out there to get money out to the folks. So we'll send an email out, and people, if they're busy that week, they don't have to take part. That's, it's all totally voluntary. But if they're interested, boom, there's usually a link people click on. And if it's a survey, you click on it and you'll answer a few questions, you go right into the survey. If it's a phone or a Zoom interview, you'll answer a few questions. They'll tell you whether you qualify or not, and then they'll schedule a time for you to choose to do an interview. So we try to make it as simple as possible, obviously, because we want people to have it like that. Well, and then when people are done, as soon as the study is done, we confirm with the client, okay, these 10 people did it. They'll give us the code numbers, and we'll figure out who. And we send their checkout right away, because as I said, we want people to get rewarded as soon as possible. We want people to like us, right? So they'll do the study the next time.
Absolutely. Now, for the people out there, I believe, if I'm not mistaken, you have to be 16 or older to participate.
Yeah, there's some rules. We try to be err on the side of protecting people. 16 or older. Now, some folks with their parents' permission can be invited to study, but in those cases, we usually go through the parents. The parents can sign up as caregivers. If they're if it's a child, they're going to be going to the doctor, they're going to be helping with medical decisions and all. So they sign up as a caregiver. And sometimes there's studies where they actually want to talk to teens or whatever, younger than that, but with the parents' permission, or they can both be on the same phone, that kind of thing like that. But once they get hit that age, they can sign up in their own regard and take part. And the parents can still be involved as a caregiver. And caregivers could be a spouse. It could be an adult, it's like an Alzheimer's patient, right? You might be an adult daughter of somebody with Alzheimer's, and you're a caregiver. So we're always welcoming caregivers, because so many of our clients want to talk to them, right? Not just the patient, because some diseases too, the patients aren't able to. There's some severe epilepsies and things, right, where the patients aren't able to, and we want to get the caregivers. Others where both of them are welcome to a study, because they really want to get the opinions of everybody.
So each study would say, hey, we're looking for caregivers or patients only.
Yeah.
Okay, so there would be
and sometimes what we'll do is, if a study is specifically, say, looking for patients, we may send it out to the caregivers too, and tell them that, say, hey, you may not qualify, but please pass this on to the patient you care for. Maybe they're interested in it.
Right. Okay, that makes sense. Now, can you explain to us, and I know this happens, there's reasons why, even though someone has the disease state, he or she may be turned down for the survey or study. So somebody, say, has lupus, right, and they sign up and they go, oh, this is great. I'm going to make, $60 for a half an hour's work. And then they say, hey, no, sorry, you don't qualify. Can you explain to our audience why that?
Yeah, and that's probably one of the most frustrating things for folks. What it is if the companies that are sponsoring these studies have very specific needs, and they can vary. For example, say they want people that are taking a certain drug. Well, we can't tell you ahead of time, hey, we're just looking for people with a certain drug. We might want to, but that could open us up to fraud, right? Oh yeah, I'm taking that. So sometimes we can't tell you everything. We certainly can tell you the general category. So there's certain specific things. They might want a certain age. They might want people on a certain medication. They might want people with certain subtypes or certain symptoms. Sometimes they might want somebody exactly like you. But guess what? They're doing 10 interviews and they already got 3 people just like that, and they want to get different people. So there's various reasons that these companies have their qualifications, and it can be frustrating to people. What we offer is a couple things. We say, if you don't qualify, please ask the project manager. They may be able to tell you why not. It may not change anything, but it makes people feel better. It makes them feel like they weren't discriminated against, right? Oh, I see. It was this particular issue. And the other thing is, sometimes people say, I didn't qualify and you're taking my data and I'm not getting, and no, if you don't qualify, nobody touches any of your data. Nobody sees any of that. That wouldn't be right. If they were using that, that means you qualified to some degree, and we would, we'll use the term complete. You would be a complete, and you would get compensated. So we're very strict about that. But it is a frustrating thing because people want to participate, right? They want their voices heard. They say, I have this disease. Why didn't they want me? It's like, well, you should some of these things they call it a screener or inclusion exclusion criteria. Sometimes they run pages and pages. It's like, oh my goodness, it's not just, hey, do you have lupus?
Yeah. So there's certain parameters that have to be met, and so we don't want people getting frustrated.
Right. I appreciate people. Give it a try. We always say, look, those initial questions to see whether you're in or out.
The podcast is so happy and proud to have Blue Sky CBD as one of our sponsors and supporters. At Blue Sky CBD, they know that the highest quality CBD starts from the seed. Blue Sky partners with sustainable, responsible farms for superior hemp plants to extract their CBD and other healthful phytonutrients. Each of Blue Sky's products contain high concentrations of CBD for maximum impact, and Blue Sky offers some of the lowest cost per milligram CBD on the market. All Blue Sky's products are THC free and are tested by a third-party laboratory for potency and purity. All this has made Blue Sky one of the only brands trusted by healthcare professionals across the United States. As the demand for CBD and its therapeutic potential have grown rapidly worldwide, it's difficult to know which products you can trust. At Blue Sky CBD, they don't just sell their products, they use their products. Blue Sky CBD proudly shares testimonials of their loved ones who use these products. Blue Sky CBD guarantees the potency and purity of each and every product they sell. Blue Sky tests their products 3 times. First, the plant is tested, next the isolate, and last, the final product to ensure each product batch meets Blue Sky's high standards. A copy of the certificate of analysis is linked below each product description online. The Blue Sky CBD website contains client testimonials, including a case study for each testimonial from people just like you regarding people dealing with severe anxiety and insomnia, high blood pressure, pain management, headache, rheumatoid arthritis and spondylitis, and endocrine balance. Blue Sky even makes the product Pet Love for our canine and feline family members. There is some confusion between medical marijuana, CBDs that contain THC, and the THC-free hemp CBDs within states. Blue Sky CBD uses CBD derived from hemp that is THC-free, which is drug-free and can be sold everywhere legally. Blue Sky CBD wants you to feel confident with your purchase and offers you excellent customer service. If you are not satisfied with their products, you may request a refund of the full purchase price within 30 days of the product received date. When ordering, please use the podcast link to receive 20% off your initial purchase. The link and website information will be listed in the podcast notes.
It should really only be about 5 minutes. So it's an investment of time you have to make to see if you're going to qualify.
Right.
If it's longer than that, we say you got to compensate people anyway. So try to do that, and then over time you'll see. And you should qualify from time to time, unless you've got some different type of the disease that people aren't interested in today, but maybe they'll be interested in it tomorrow. It's always changing.
Right. Now, this podcast is heard worldwide. You launched Rare Patient Voice in the United States. When and how did you begin to expand to other countries, and what countries are involved now? So there's people out there listening to this podcast all over the world. Who qualifies?
Good question. So we started in the U.S. Then we expanded into Canada, figuring that's not totally different. Obviously, there's French as well as English in Canada, but let's try Canada, and that's been great. Though I like to joke, Canada is a very big country, but not a lot of people live there relative to the size. But our clients badgered us, if you will. They said, "We love your." We always get these compliments. We love your patients, and we're like, "What do you mean?" They're real. They want to talk. People love the voices that they hear. they said, we love it, but we can't find those patients in Europe. Can you help? And for years, I'm like, it's business-wise, it's so much easier to expand in the US than to go into other countries. But eventually we said, okay, now it's time. We're going to do that. So we expanded in the what they call the big five in Europe, the countries that the largest ones that people ask the most about. It's the United Kingdom, France, Germany, Italy, and Spain. So you got new languages there. So we have to have websites with Italian, Spanish, and German, people that speak that language to deal with the patients, and that kind of thing with the clients. So over the last couple of years, we've done that. And so if we've got 100,000 or so in the US, we've got like 25,000 in Europe. So it's still small. We haven't been able to go to nearly the patient events because it's been COVID. We started this during COVID.
Right.
But we've gotten great word of mouth. We work with so many advocacy groups, right? And so many of them are either international, so they'll help us everywhere, or even if they're US based, they partner, they know that they're affiliated with a lot of the ones in other countries, and they spread the word for us. So that's and patients, right? As just like people listen to your podcast all over the world, patients now, if they have a Facebook page, the internet doesn't stop it, right? It's all over the world. And so
Right.
a lot of them have connections all over, and that really helps us out too.
Do you foresee you expanding to other countries?
Sure. I mean, I loved, and I didn't mention, we also went to Australia and New Zealand. Now the numbers are very small. That was more a matter of, hey, the English language website we have will work in those countries. But people do, there is a lot of demand for India, for China, for Japan, for Brazil, for Mexico. So at some point we'll do that. It's one step at a time.
Okay.
You know,
So what you just said, our listeners in Australia, New Zealand, are they eligible?
Yes, sign right up. And even if you're not in the countries I mentioned, you can still sign up. We put you in a category. I don't mean this to be derogatory. We call it all other countries.
Okay.
But over time, but what we just have to say, we may not be inviting you to many studies for a while because, we haven't focused on other countries, and the clients, we don't have a lot of people there, won't be a lot of studies. But we're happy to let you join no matter what country you live in.
Okay, so for everybody out there listening, obviously the US, we have Canada, we have the United Kingdom, Germany, France, Italy, Spain, Australia, New Zealand, and all other countries.
Any other place, it's just that we may not have studies for you soon.
Right.
But we're happy to have you join.
But if you want to sign up, sign up. What has most surprised you over the course of the past decade?
I guess so. How when I go to these patient events, I'm like, gee, if I were diagnosed with this, or my kid was diagnosed with this disease, I don't know what I would do. And I'm seeing these people fighting it, coming to the events and doing things. And I'm like, I'm just amazed about the people's resilience. Then I think, well, they didn't just get diagnosed today. They may have gone through that period, and I'm seeing them a year later, or whatever the case may be. But it's still amazing what people do. And even some people they'll have a stage 4 cancer, and they may not have long to live, and they still participate because they think, hey, this is going to help other people. They're thinking about others. I used to say, I'm not going to bother somebody with stage 4 cancer. They've got something better to do with their time than doing survey. And I'm sure there's some people that feel that way, but BBAP people say, no, please, invite me. I want to take part. As long as I can, I want to take part. So that's just amazed me, the strength of the people and their families. And you'll see a lot of parents, for example, of kids, their children have passed away. They still come to support the organizations. They still say, can I sign up? I might have something to offer. So it's people, right? People are amazing.
Yeah. Well, you're looking at a 2-time male breast cancer survivor, and I've got lymphedema as well. So, we're not giving up. We're here helping people.
Yeah.
And I've got a lot of people in stage 4 that same way. They're just going down fighting. They're going down
and
helping people. It's amazing.
The improvements that have been made in cancer in the last 10 years. Right? I mean, it's amazing what they've done with these new treatments. I like to think in 20 years, we'll look back and see how stupid we are now, right? Because we'll have figured out so many more things.
Yeah. Where would you like to see Rare Patient Voice 10 years from now?
Geez, certainly. Hey, if we can be in more countries, if we can have more people. One of the things that we've just started doing, and you mentioned at the very beginning, is invite people to clinical trials. That's a new area for us because my background was market research and opinions. We said we don't want your blood. Well, clinical trials are a whole different ballgame where a lot of people will not qualify for a clinical trial because they're very specific criteria they have, but it can save people's lives. And a lot of times people don't know about them. So if we can help spread the word about clinical trials and get people involved in them, and some trials don't happen because they don't get enough people. Can you imagine a life-saving drug and it's delayed for years and years because the trial isn't there because we can't, they're not allowed to prove a drug if it's not been tried. So we're gonna expand in that area, and we have been. So that's very exciting. And who knows? Everything that's happened has been a surprise to me. It looks clear in hindsight, but I didn't.
Yeah.
I didn't know it was going to happen.
Well, that sounds really amazing. We'll have to check back with you 10 years from now.
Yeah, exactly. See what happens.
Can you give us a few examples of how Rare Patient Voice has helped some of your enrolled patients or caregivers improve their lives, and also on the flip side, help the researchers in their jobs?
Yeah. I was thinking, I remember when we first started, and as how I said, I started especially in hemophilia, and there was a family in, somewhere in the West. I can't remember exactly now, but they didn't even have a computer. And they would walk like a mile or more to the library to do a survey on the computer there. And I got the most lovely note at Christmas time saying, hey, we were able to do a few studies. You made our Christmas. We have a couple little kids and we didn't have a penny. And we got a few $100s here and there. And you really made it possible for us. Because you're thinking, you're giving $100 here or there. For some people, that's the difference. Especially think about so many people that are disabled or on disability. Or so often people give up a career, especially a mom will give up a career because her kid needs 24/7 care, or they have to move to be closer to some specialized hospital.
Yeah.
And so they've given up a lot of economic whatever. And so we're not, as I say, we're not making anybody rich, but $100 here or there, I was amazed at how that can help some people, get over the hump. So we get notes like that all the time from folks. So it's very rewarding. It's funny. We never see the results of the study. So it's like people, how did that study go? It's like, as I say, we don't see the answers. We don't know. But I like one of our team members is an MS patient, and he did a study for a new type of cane. And he claims that his feedback changed that. Now, it probably was more than just his, because they might not have done it if only one person. But he had a new way for them to do something. He's sure that he improved that for folks with MS, or a lot of folks that need canes, not just those with MS. I know in general, though, so many companies, they've figured out, because of what the patients have said, better how to explain things, how to word them, what issues patients have. Because so many of our studies, it's when a drug is new, before it's out on them, they're waiting for it to be approved and they're getting ready to market it. And they want to hear from patients based on a description. They won't give them the name, but they'll give them a description. And what do they like? What don't they like? What would they discuss? What do they need more explanation about? And that helps them be better people, because they market it in the right language, right? Don't use doctor language to patients. They don't understand that. It helps them explain it. It helps them emphasize the key points. It helps them get them over any hurdles that they might have about a side effect, whatever it might be. It really helps them do that.
Now, for those out there, Wes, with a dream of their own about starting a project, but are hesitant or told that it might not be possible, what advice can you offer them?
Oh, I mean, as I said, I had to be forced, right? Don't be like me. Take a chance, take a risk. It's easy to say that, but everything's a risk, right?
Right.
So try it. You can try things and maybe keep it low. Because even when I did it, we didn't have huge expenses. I didn't try to be big the first night. It was just me doing things, and it's like, let me build it slowly. So give it a try. get started, try it. And once I got started, one thing led to another. I was wrong about 1,000,001 things, right? I didn't know I didn't know we needed non-rare. I didn't know that we would get patients to refer other patients. I thought we'd have to go to all these. So many things happened that made it work out.
Yeah.
But you don't know until you start, because the world will tell you, but listen, right? Listen to it and adjust.
Right. Just don't sit on the sideline thinking about it.
Yeah,
You got to
because
get
I
off
thought
your
about it
butt and
for
do
years.
it.
And,
Yeah.
thank God nobody else did it in the meantime.
Yeah. Again, let's go over that. Now, what is the rate of pay for caregivers and patients who participate in the study?
Okay, so it's based on 120 per hour. So a lot of times the phone interviews or Zoom interviews are an hour. So it's $120 by check. If it's a survey, usually they're not that long. A 30-minute survey, that would be $60. So it's all based on that thing with a minimum of, I think, $25. Because even if it's a couple minutes, you figure, hey, you're giving your time and trouble, and you're saying you get more than that amount.
Okay, so for everybody out there who wants to sign up with Rare Patient Voice, you can sign up through the podcast link, and that's going to be listed in the podcast notes. Now, how much has Rare Patient Voice paid out over the years?
Yeah, so over $10 million.
$10 million. Wow.
$10 million to patients. So and it's growing because we're growing, and every year it's more. So yeah, every week we send out checks, $50,000 to $100,000 in checks. So it's amazing, and it's physicians do research, and that's very important, and they get paid a lot. Patients' opinions are important too. They should get paid. And I say, some people say, oh, I don't need to get paid for this. And I said, well, I think it's important that patients get paid, because if you're a pharmaceutical company, you pay more attention to what you pay for than what's free. And so they'll say, wait a minute, we paid these people. Let's listen to what they have to say. So I think there's a value even to the pharmaceutical industry to have the patients paid. And it's certainly a value to the patients, because some people say, well, I don't have any expertise. Yes, you do. You are an expert in what you're doing. Nobody knows like you do. You know what you know. So
yeah, absolutely.
People are willing to pay it.
Let's take lymphedema, for example, which I have. If I can get a study and give my opinion, because I have a lot of opinions on it, because who knows it better than the patient that has to deal with all this, contraptions and things, the garments and all that stuff.
And if you think about, if you're a marketing person for a biotech firm, you have a lot of decisions to make. How you're going to market it, and how you're going to package it, and what are you going to sell it for. If you don't hear from the patient, you're going to make those decisions anyway. So you might as well hear from them and help make a better decision. Because if you just base it on yourself, you're not hanging out with the run-of-the-mill patient. You're hanging out with other MBAs in some ivory town. That's right. That's not the real world. They need to hear what people are thinking, and how they feel, and how they talk, and what they understand.
I couldn't agree with you more. And sometimes I kind of link it to when you buy your kid a toy or something that you have to put together, and you're constantly going, who came up with this?
Yeah.
I can't think only engineers. Come on, guy.
Only engineers are building this. It's like, no, regular parents are trying to do this.
Exactly. I think everybody's running into that. Wes, for those out there with questions about the program, what is the best way for them to contact Rare Patient Voice?
Well, a couple. I usually just think of my email, which is wes.michael@rarepatientvoice.com. But we do have a better one now. Contact us at rarepatientvoice.com. That's a good one.
Okay, contact.
I know that. We have various, emails to make it easy for people, and I can't remember.
So. Okay, contact us.
Contact us at
rarepatientvoice.com.
And you can put that in your notes.
Okay, that'd be in the podcast notes.
Yeah.
For anybody who has questions that we have not touched upon.
And then our website, everything, all those emails, all the information we can think of. We have a whole list of the FAQs, the fairly, frequently asked questions, on our website, rarepatientvoice.com. So we're happy if people call in with questions. I love it when people have questions. It means they're interested. Yeah,
that's great. I want to thank you so much, Wes, for being here today. And all the best going forward with all your endeavors.
Well,
Wish you
thanks,
a lot of
Ron.
luck.
I really, it's a treat to be on with you and to share everything with your listeners all around the world.
Yeah, it's great. For those out there who have comments and suggestions for the podcast, you can email me at itsarapwithrap@gmail.com. We have a website, itsarapwithrap.com. All the episodes are on there. There's future podcasts on there and logo merchandise for sale, all that kind of stuff. We have a Facebook group, It's a Rap with Rap. And we're on Instagram. It's a Rap with Rap podcast. And all the podcast episodes are on our YouTube channel. It's a Rap with Rap, the podcast uncut. I want to thank everyone for listening. Please stay safe. And for now, it's a wrap.